Rick, I wanted to ask you a question. What type of medical malpractice claims can be made with a failure to diagnose sepsis? What happens with that type of claim for a client?
Well, sepsis is just internal infection, and we all have to understand hospitals will have outbreaks of infections, and there's no medical malpractice claim involved in some of those types of situations. But what we're looking for is where a patient develops an infection while they're in the care of their attending physician, and the doctor, for whatever reasons, doesn't monitor or recognize the signs and symptoms of a serious infection which can turn into sepsis. That's what we look for as a potential medical malpractice claim.
Okay. What constitutes a medical malpractice when there is sepsis involved with the patient?
Well, typically, a patient in a hospital after a surgery or a procedure is supposed to get better within the first several days. There's supposed to be a trend line where they're improving. But when a patient is not improving day after day, and ultimately sepsis is diagnosed, the question becomes, well, were the vital signs being monitored? Did the doctor order the appropriate tests to determine if a serious sepsis was ongoing? It's the failure to properly monitor and recognize the infection that is a subject of medical malpractice claims.
Thank you, Rick.